Last week we discussed the Transitional Care Program at Medical Center Hospital. Today we are finishing that discussion with some ideas of the specific ways that the hospital might be able to help you or someone you love. It's this week's Medical Center Health Systems Taking Care of You. Our guest today is Diana Ruiz, who is the Director of Community Health at the hospital. Thanks so much for being here with us today. Last week we established that the program really had two goals: to maintain the health of the patient, both in the hospital and when they're discharged, and also to avoid readmission. So tell me a little bit about what the program can offer for a patient once they have left the hospital.
Sure. So our transitional care program, as we mentioned before, has two phases: inpatient and the outpatient. So in the outpatient world, the things that we can offer patients are really individualized. So we can't say everyone gets the same plan, right? You may have more needs than others or less needs than others. So everyone gets this typical phone calls, right, where we follow up and see how things are going. But other services we can offer are things like medication vouchers, transportation vouchers if needed, and we typically try to partner our patients with community resources. So again, if you might be in assistance of a utility bill paid, okay, we can filter you in that direction. If you need a ramp maybe built for your home because you have a wheelchair and you can't get in and out of it easily, then we'll partner you with that community resource. So it's really very individualized for each patient, but there are so many gems, I think, as you mentioned earlier, in the community, so many resources available that we just need to help maybe plug in patients with those resources.
So I'm trying to think, as just a regular person in the community, if I needed one of those things, I wouldn't know where to begin to turn. But that's the goal of the program, is to navigate you through those areas. One thing we do want to say is this is not a magic bullet. No one is saying we're going to solve all of your problems, but it is certainly a concerted effort to make the process more smooth.
Absolutely. So we have a lot of patients that have a lot of medical needs or a lot of financial needs, and you mentioned it. There's no magic wand. We're not going to be able to fix every single problem, but we absolutely can help you in the things that you need, such as medications, transportation, finding a provider. You know, Medical Center is a very big system now, and we have a lot of different provider partners that can help see these types of patients that need those unique services.
So let's talk about the funding on this a little bit, because it is a great opportunity that the hospital has. Tell me a little bit about how that came into play.
Sure. So we actually are the subcontractor for an Ector County Healthcare Coalition grant. So we're very lucky to be partnering with the state of Texas to actually fund some of these services that we provide patients. So the coalition, which a lot of our community members already are aware of, we meet about every other month, and that coalition comes together to decide how should we spend this money that we get from the state every year. And so some of that money is spent on purchasing minor equipment for patients, like glucometers, blood pressure cuffs, scales even, to weigh themselves. So all in an effort to promote education, to promote health and wellness, and to prevent readmissions.
This is such a fascinating program, and again, anyone can call and get information. The number is 640-2680. But a lot of people will be sort of placed in this program because the hospital feels like it would benefit them, and so it should be seen as sort of a gift or a resource for them.
Absolutely. It's just a seamless transition from the inpatient to the outpatient side.
Well, we appreciate the hospital doing that and look forward to learning more about it. Diana, thank you so much for being here with us today.